Can someone give me a thumbs up? Can you give me a thumbs up, Mrs. Roush? Yeah, great. Okay, great. All right, everybody. So welcome. I'm Dr. Shiller, and we're going to talk about osteoarthritis. And there's so much to talk about in this topic. It's an incredibly broad concept. What I'm going to aim to do today is really give an overview that talks about kind of the big picture of what's the new reality in osteoarthritis, because the new reality in the 21st century is very different than the 20th century. A lot of doctors are still operating on 20th century principles, and they're not really looking at the new science. So I want to share the big picture. I'm going to share some of the science and try to keep it focused and simple. I invite you to let it wash over you. Don't worry about the details. We're going to cover a very broad swath. And what I'm aiming to do in future webinars and talks, and who knows where else, maybe blog posts, is talk in more detail about the details, because the details is where it matters. Like, what do you do on a day-to-day basis? That's incredibly important. But I want you to have the big picture. So let me just have a look here. There's people coming into the waiting room. I'm just going to check in with my assistant who's doing the details here. Let me just make sure that we're letting people in. Bear with me 1 second. Okay, great. All right, good. So we're rolling. I think he's admitting people as they're coming. Terrific. All right, so let's jump into it, shall we? I'm going to leave some time for questions at the end. So hold your questions. Although the other thing you can do is, if you have a question, put it into a chat. I'll keep an eye on that to a certain extent. And if there's things that are coming up that are, significant questions, I'll try to respond to them as we go along. All right, so there we go. What is arthritis? What's the 21st century science? This notion that arthritis is not inflammatory, osteoarthritis is not inflammatory, is sort of being, that whole idea is changing. It's a new paradigm. And we're going to talk a little bit about, and kind of the overview of, how do we treat pain? How do we treat and help function improve? And how do we get the actual disease process of osteoarthritis? And so those are the main points we'll get at. So, arthritis is basically pain, or that doesn't go away, or it comes back in a joint, warmth, redness, swelling. This is probably pretty basic stuff. I know some of you who are out there, and I know you're dealing with this on a regular basis. So you don't need me to tell you about warmth and swelling and stiffness and pain that doesn't go away, and then sometimes trouble moving joints. That's the general definition of arthritis. And arthritis can affect many different joints. When we talk about osteoarthritis, it's mainly knee and hip and hands are the main ones, but arthritis can affect the spine, the hands, the elbows, the ankles, every joint in the body. The temporal mandibular joint can have arthritis in it. So, here's from the Cleveland Clinic, and here they give that definition of osteoarthritis, which is wear and tear, not. But we're going to focus on that, right? We're going to focus on osteoarthritis. You may have heard of rheumatoid arthritis, which is more of an autoimmune disease against the joint tissues. Gout, which is where the body creates these kind of crystals that precipitate into the joint and create inflammation. Ankylosing spondylitis and psoriatic arthritis, which mainly affect the spine, but can affect other joints too. And then there's juvenile rheumatoid arthritis. So we're going to focus on osteoarthritis in this conversation today. And so, the classic signs of inflammation, this is a really important distinction, because, until 20 years ago, you ask the average doc, well, maybe they'll still say it, but what's inflammation? And they'll say redness, pain, swelling, and heat. Those are the four cardinal signs of inflammation: rubor, calor, dolor, and turgor. Those are the Latin things we learn in medical school. And that's what we used to understand was inflammation. Sometimes there's an elevated white blood count, or these clinical markers like a ESR or a CRP. And in rheumatoid arthritis, you can get rapid breakdown of the joint. And then osteoarthritis was understood to be, well, there's no inflammation there. It's just wear and tear. But what we know now is there is low-grade inflammation. It's a subtle process where you don't get this necessarily red hot thing going on. But what you do get is this biochemical inflammation that's in the background that drives processes that create degenerative changes in the joint. And those same processes, like we'll talk about in a bit, affect potentially all of the chronic diseases that people deal with, which is part of why people with osteoarthritis get chronic illness. So it's really important to understand these things. Occasionally, someone with osteoarthritis has a warm, swollen joint because you can get what's called an effusion where fluid flows into it. And sometimes the clinical biomarkers go up, but usually they don't. On the other hand, there are research markers that they measure in labs that are elevated and changed in osteoarthritis. And so what's really going on is like this is a view of a healthy joint on the left side. And hang on a second. That is okay. That's just what's going on. Fine. Um, so that's what's happening in a healthy joint that the cartilage is smooth. You've got these menisci, and you get that nice rolling joint where the joint works just fine and it's sliding and grooving, and that's all great. You got a nice wide joint space there. And what happens in osteoarthritis is that that joint breaks down. The cartilage breaks down. Over time, the cartilage can completely go away, and you can get this bone on bone thing, right? You get bone spurs, which can be a source of pain because they're like pokey things in the joint. And you get narrowing of the joint, which can cause these changes in the biomechanics. And on a biomechanical level, it can be like a vicious cycle where you lose cartilage and that nice smooth surface is no longer there. And you get these bony things and pointy things that are creating more pressure, which creates more breakdown. And so that kind of and so it's a degenerative process that happens over the course of a long time. It's typically not a quick process like rheumatoid arthritis, but like many of you might know, okay, my knee started hurting a little bit a few years ago, and then it got worse, and then it got worse, and then it got worse, and then they said I have osteoarthritis. Well, that is the way it goes sometimes, for sure. Um, Welcome those of you who are just arriving. We're talking about osteoarthritis and the modern 21st century view of it and understanding of it, because it helps you figure out what to do about it. So you're not just stuck in the 20th century like a lot of doctors and patients. So in any event, this degenerative process happens where the joint breaks down and it hurts. That's the worst thing most people describe, but some people get loss of joint function, hard to bend, stiffness. The stiffness is frequently worse in the morning or when you've been immobile for a while. There's this process in osteoarthritis called gelling. It's one of those classic things when the person says, yeah, I'm really stiff and uncomfortable when I first get up, but then once I walk around for a while, it gets better. That's sort of a classic osteoarthritis thing, as opposed to a like hot inflammatory arthritis like rheumatoid arthritis or gout flare-up or something like that. The really important thing to know is that okay, yeah, there's this loss of function for the joints being stiff. There's frequently kind of a behavioral response to it, which is like, it hurts, so I don't want to move. We'll talk more about that later. And the real key thing to hear right now, so really listen to this, is that there are a number of different other chronic illnesses that go along with osteoarthritis that you see more frequently with people who have osteoarthritis. And part of it is the new understanding of what causes osteoarthritis, because we got these underlying biological imbalances that cause these other diseases too. So that's why I really want you to understand this stuff. So cardiovascular disease, depression, anxiety, diabetes, stroke, dementia, chronic pain syndrome, fibromyalgia, really tough, difficult things going on. So um, osteoarthritis is growing. These are estimates from, 2015, I think it was, where they had this initial data with it growing from like, this is just in the United States, from like 46 million people to 54 million people over the course of about 10 years there, a little bit less than that. And this is their projection for where it's going to go up into 2040, like maybe 80 million people with osteoarthritis in America. And worldwide, even huger numbers than that because it's a big world we live in. So it's incredibly important that we find solutions to potentially change the course of osteoarthritis. Because old school 20th century osteoarthritis management is really about just treating the pain and hoping you don't have to get a joint replacement. And so we're starting to understand things about what causes it and seeing things that we can do that we'll talk about that actually can slow that process. So that's what's so exciting about thinking about this now in 2023, where we've got like a few decades of research that are showing us like, wow, it's not what we thought at all. There's things we can do that are lifestyle things to intervene and make this problem better. So let's unpack what that is. Right, obesity and osteoarthritis. It's been known forever. This is what I learned. People who are obese are overweight, and because it's overweight, then it's too much wear and tear on the joints. And that's what doctors would say to the patient, Mr. Jones, overweight people are more likely to have osteoarthritis because if you're overweight, you're heavy, and that means increased wear and tear on your joints. So you should lose some weight. Like that was the old understanding. But that's not the new understanding. What we're understanding now is that extra fat tissue actually is inflammatory and it drives a whole set of biochemical changes that drives osteoarthritis. So being overweight and having extra fat, it's not just that you're heavier than your joints want you to be. It's that you have a systemic metabolic thing going on that's inflammatory and drives the disease process of osteoarthritis as well as the disease process of other stuff that's no fun to have. So let's keep moving forward here. So yeah, 21st century thinking is much different than 20th century thinking. It's not like that with Mr. Jones. And somehow it's still in the mainstream sites, right? I went to Hopkins Medicine, Johns Hopkins Hospital 2 days ago, 3 days ago, and here's what they say on their website about osteoarthritis. Osteoarthritis is caused by wear and tear of the joint over time because of overuse. They're missing 20 years of research. They're not talking about it. This isn't so surprising. It's actually well known that medical research doesn't get into the clinic for a long time, like 20 or 30 years. And, objectively, scientifically, there are reasons for that because our new understanding of osteoarthritis is new. And science is still working out the details about, well, what do we want to do about this? How do we turn this into treatments? What do we recommend for people? How do we know what's safe and not safe? It's a really complex question. So giving credit to the conservative nature of medicine, because, one of the things that they always taught me in medical school was first do no harm. And they don't want to promote uncertainty. They want certainty first. But as we know, we're living in a world that's more and more uncertain. There's lots of complex influences that are affecting what information gets given to the public and what treatments are given to the public. I know a lot of your faces out there, you're very tuned into this kind of thing. It's not the benevolent thing like we thought it was. There's a lot of financial interests and political interests and all sorts of things going on. But there is also reasonably a scientific interest in, well, hold the horses. Let's make sure these things are really true and we know what to do with it before we put it on a John Hopkins website. But it could be that because you're here, you're interested in a more progressive understanding. My view is that, especially with issues where lifestyle changes can make a difference, we're talking about safe things, not drugs with horrible side effects. We're talking about things that are generally safe. There's much more latitude to be progressive, to get at the cutting edge of what we know in science, and actually come up with intervention that can make a difference for people at low risk to them. So let's keep moving. All right. Yes. No, that's not the answer anymore. Cross it out. So what is the answer? The answer is that osteoarthritis is caused by a complex holistic process. It's systems biology, where all your systems are interacting with each other. Your immune system, your joints, your brain, your gastrointestinal system, your hormones, your brilliantly complex system of little molecules that are communicating among all of your cells. It's astonishing what goes into it. We're going to touch on that, hopefully in a way that won't explode your brain like it explodes mine. There's so much to know about this. It's outrageous. But basically, we still know that mechanical stress is important, right? It puts physical stress on the cartilage. But we know that there's biochemical and metabolic stress. And we know that excess body fat is an inflammatory organ. It produces all sorts of chemistry that drives that metabolic stress on the joint. We know that mental emotional stress can affect inflammation, that there are immune changes, that there's brain signaling changes, and even more, and we'll dive into it. Complex, holistic process, systems biology, backed by ongoing scientific understanding. Okay, the gut-brain immune interactions, brain, gut, immune. This is showing up in every field of specialty, whether it's arthritis medicine or diabetes or neurodegenerative disease or cardiovascular disease or psychiatry. All of the journals are starting to look at gut-brain immune interactions as being drivers of the chronic illnesses that conventional medicine doesn't know what to do with. And osteoarthritis is no different, right? And so it's interactions among these things that'll unpack a little bit that create joint degeneration like we talked about before. So one of the things that's going on in the gut is this process called leaky gut. You may have heard that language. It also gets called intestinal permeability or intestinal hyperpermeability. If you look on the left side of this slide, you see these cells, right? This is the inside of your gut, and this is the blood vessels running along it, right? And so here's where your food moves through. Here's where your biome lives, all of the trillions of bacteria and viruses and fungi that are normal inhabitants of your gastrointestinal tract. And on the left side, we've got these healthy cells that have something called tight junctions. I'm not sure if you can see it, that holds the cells together. And what it does is it makes it so that your intestines are like an incredible filter. And all they do is bring fluids and digested food across to the blood vessels where they feed the body, where you absorb fluids, you absorb nutrients. But a variety of different things create this situation called leaky gut or intestinal hyperpermeability, where those tight junctions break down and you get little particles from bacteria and partially digested food crossing over that cellular boundary and getting to the blood vessels. So besides the blood vessels, what have you got wrapped around your gut? You've got a massive immune organ called your gut-associated lymphoid tissue, or GALT. Doesn't matter what the name is. The point is that, your gut is like an interface. It's like the border of a country, and there's soldiers on the border making sure that the bad guys don't come across. And so that is your immune system surveying your gut. And when you get leaky gut, you get all this stuff moving across the barrier and creating a systemic inflammatory response. The other thing that happens is that, bacteria in the gut produce this thing called LPS, or lipopolysaccharide. And when that gets into the body, wow, bad stuff happens. If you've ever heard of someone who got a bloodstream infection where they got really sick, that's endotoxemia, that's lipopolysaccharide that can cause a massive systemic inflammation and kill a person, God forbid, if it's a really big time, inoculation of that. But when it's just a drip over the course of time, it doesn't make a person super sick like that. But what it does do is cause systemic inflammation. And that's one of the things that leaky gut does. And that's how it contributes to so many different kinds of chronic illness. And so here's another view of that. And what this is doing, it's the same thing. Here's the inside of your gut. Here are those nice little cells protecting it as a barrier. And here's that brain-gut connection. And this is the vagus nerve. Has anyone heard of the vagus nerve? It's your big sort of gut-affecting relaxation nerve. But the vagus nerve can do all sorts of different stuff. And when we'll get into this in more detail, but basically the body's responding to perceived danger, whether it's biochemical danger, environmental danger. There's a war, there's a fire, there's a boss who's a mean person, there's an ex-husband who's nasty, who knows, whatever the stressor is. But you get changes in the way the brain and the chemicals from the brain work that can break down and cause leaky gut. That can change the ecology of the gut flora. Just having a chronic stress response. And then there's other things like antibiotics and medications and all of that that break down this barrier. And it's not just brain gut, but there's other systems that get involved, like your hormones, nerve function, this process called oxidative stress, which is like biochemical stress, cellular energy, the structure of your body, detox systems. It's super complex biology. It's astonishing and it's beautiful and it's awesome when it works. And I'm really into helping it work better for people. So that's what we're talking about. All right. This is a lot of information, right? I hope it's not overwhelming. Are people having fun? Some people are nodding. It's good. Okay. So here's that whole gut, brain, immune, joint degeneration thing. And I'm just sort of spelling out that all this other stuff is involved too. We talked already about hormones, inflammation, oxidative stress, but mood, behavior, diet. When someone's under stress and feels crummy and they have pain, they tend to eat comfort foods, which feed into other problems. Maybe they're drinking too much alcohol or smoking, which create a toxic load on the body. Maybe they're doing less physical activity, and physical activity is so incredibly healthy and important. Social isolation because of feeling sick, of feeling pain, not being able to get out and about, the stress of social isolation. If we were to put all of these things in relationship, and they'd be in a circle and there'd be like a million arrows and we'd lose our minds looking at it. But like everything here is everything connected with everything else. And that's the brilliance and beauty and complexity of systems biology, because we're learning about all these interconnections with things. We're learning about all these different variables are influencing our health and our disease processes, and that we can mobilize them to lead us towards health as well. So just touching on that. Here is another key point. The gut-brain immune interactions that cause osteoarthritis through these other variables like we just talked about are what drives so many different chronic illnesses, like chronic pain, fibromyalgia, abdominal pain, fatigue, depression, anxiety, migraine, neurodegenerative problems like Alzheimer's or Parkinson's disease, neuropathy, dementia, autoimmune disease, chronic fatigue syndrome, Hashimoto's thyroiditis, other autoimmune diseases. And these are drivers of that. And that's what we're seeing throughout the medical literature. So this is part of why it's so incredibly important, if you have a significant amount of osteoarthritis, to also be thinking about, okay, I need to work on these underlying drivers. I need to get my gut healthy, my stress level healthy, my immune system healthy. The other thing I want to just add is this piece about autonomic imbalance. We'll talk about more in a second, but basically that stress response, that leaning towards, oh my gosh, there's danger, whether it's perceived or real, the body thinks it's real. And that's one of the drivers. That's one of the wheels that puts juice behind this whole thing, because it creates a danger signal. And that danger signal primes and shifts all of these other systems. And it's part of what creates the illness response. That's why I do so much stuff with mind body stuff, because it's all about how do you create safety for your body and safety for your cells. Okay, so that's a ton of information. You weren't supposed to see this little yellow box, just the sunflowers, but here it is, whatever. This is the rest slide, right? Just to sum up that there's all these processes of inflammation, oxidative stress, dysbiosis, leaky gut, autoimmune imbalance, autonomic imbalance, and obesity-related inflammation. And just to give you a quick understanding, I'm going to run through this a bit, but like, this is not just my idea, okay? Like, if you do a medical on PubMed and you look up arthritis and the microbiome, and this is just 2016 to 2024, first of all, you see how those citations going up. This is exploding research. I mean, research is exploding everywhere, but especially in microbiome relationships with so many diseases. And it's 1,000 papers about arthritis in the microbiome. If you look at only osteoarthritis, which like we talked about, I think it got a slower uptake, right? Because people were understanding, well, microbiome and inflammation, and everyone was thinking like, well, like, osteoarthritis isn't inflammatory, right? So it took a while for that to catch up. There's a lot more research in things like psoriatic arthritis in the microbiome, or rheumatoid arthritis in the microbiome, but there's a significant body that's growing. I found like 120 papers in the past 3 years on the microbiome and osteoarthritis. This is another view of those relationships. It's another way to think about it. This is from this tremendous research group at Rockefeller University. Dr. McEwen is a huge like mind-body researcher. He's really been a real mover and shaker. And these are these different axes. You'll see in the middle, there's this chronic low-grade inflammation. And over here, it's like the joint-brain connection and the inflammatory thing in the middle. And he talks about the fatty tissue, adipose tissue brain connection, the way all those stress chemicals and fatty tissues, inflammatory molecules relate to each other. And then there's the gut brain axis, like we talked about. And then the whole central nervous system. There's more and more research about how osteoarthritis is connected to our body clock. Some of the like the higher centers that like organize the body, the daily rhythm, the circadian rhythm, something called the suprachiastic nucleus, our sleep cycles. All of these things are interconnected with these low-grade inflammatory processes, adiposity, and whether the body's storing fat or mobilizing energy, the way the gut works, the brain, all that kind of stuff. So this is big stuff, and really big people are looking at it and coming up with awesome science. And again, my view of it is that this is such a big driver of all of it. What's going on between your ears? Do you feel safe? Do you feel happy? Do you feel connected? Or do you feel disconnected and unsafe and unhappy? And we live in a hard world. It's really important to pay attention and nurture yourself and care for yourself. Okay, so autonomic imbalance, immune dysregulation, boom, massive amount of interaction because it's a danger signal, right? The autonomic system is all about, is there danger or not? The immune system is there for defense and repair. When it perceives danger, it goes into attack mode, like the autonomic nervous system. Danger, danger, danger means inflammation. And and maybe you've heard about this. Just what is that autonomic nervous system? Most of you probably know. But we've got these two branches. We've got what we call the sympathetic branch, which is your fight, flight, freeze response, your stress response, your get up and go. It's what mobilizes you for action. And here's the way the sympathetic branch of the actual nerves themselves innervate every organ in your body. And the same thing for parasympathetic, which is the relaxation response. This is recovery, repair, and heal. This is rest and digest. And again, through your vagus nerve, but also your sacral nerves, through a whole bunch of different biochemical pathways, it is innervating every bit of you. So there's this potential to have balance. But for most of us living in our time, and for those of us who've had difficult, stressful experiences or illnesses or trauma, that sympathetic response is overactive. The fight, flight, freeze is overactive. And that's part of what drives so much of this process. Okay, so I'm not really into vagal stimulation as a tech thing, but just to share with you the importance of your vagus nerve and there's importance to this autonomic balance thing. There are research companies and tech companies that are putting millions and millions of dollars in creating high-tech vagal stimulation devices where they implant by neurosurgery a little device in your neck and you wear a little thing like a little, looks like a pager or a cell phone on your belt, and it triggers your vagus nerve to fire off and trigger a relaxation response throughout your intestines into your gut-brain axis. It turns it on. And the reason these companies are spending millions is because the early research of vagal stim is astounding what it does. That people come in with horrible widespread inflammation throughout their body from rheumatoid arthritis, vagal stim, it stops them. So, this is a high-tech technology that isn't perfect yet. It has all sorts of issues, but they're trying to work it out. They're making cyborgs, you know how it is. They want to do everything. The point is that there's a pathway between your vagus nerve and certain ganglia and neurotransmitters that are all in your gut that release and block the inflammatory molecule. Right here, what this is TNF alpha. It's tumor necrosis factor. It's one of the end effectors, the chemical that drives inflammation in so many of these chronic illnesses like we've been talking about, tumor necrosis factor. And when they do vagal stimulation, it just shuts that down. It turns it off. It turns off the inflammation. And so that's why I keep teaching people how to stimulate your vagus nerve through breathing, through mindfulness, through attention, through spiritual practice, because that also works to stimulate the vagus. And it's one of the most powerful things you can do, and it's free. It creates a safety signal when you stimulate the vagus nerve, and that changes the course of chronic illness. Okay, so this is a crazy complex slide. There are dozens of articles out there with researchers who are mapping out all these zillions of different biochemicals talking to each other and doing things. This is like a schematic of the gut, and this is all these things coming from the liver. And I'm not going to go into the details. The bottom line, gut microbiome changes cause intestinal permeability and breakdown of the barrier that change the immune system throughout your body. And there's dozens and dozens of articles like this with pictures like this, which the author's particular sort of biases, you know what I mean? And a similar one from the same article, right? And it's again, it's the same idea, but what he's pointing out is that specific changes in the biome cause an increase in joint inflammation. And at the same time, they activate immune cells that are called macrophages. And macrophages, when they are activated, they're the attack cells of the immune system. So dysbiosis, leaky gut, immune system attack. Are you hearing how important this is? You need to really get it because there's so much that we can do to shift that. Okay. This is a crazy drawing. I don't expect anyone to understand it, but it's just another way of organizing the same set of principles that I've already talked about. It's in an article that's called An Integrated View of Stressors as Causative Agents in Osteoarthritis Pathogenesis from Biomolecules in 2023. Briefly, it's talking here about inflammation and cell signaling and oxidation as a core thing that's affecting these other 5 domains. And those 5 domains are mechanical stress on the joint, mitochondrial stress, where the mitochondria don't work and create a sick cell, basically, DNA damage, where the actual process of cellular division gets sick, and protein stress, where proteins don't work properly, as well as metabolic stress from overweight and from too much fatty tissue. So again, we are reviewing osteoarthritis, reviewing and just getting a big picture about the 21st century science, which tells us that osteoarthritis is not a wear and tear disease. Osteoarthritis, yeah, wear matters and mechanical loading matters, but there's a whole set of biochemical and metabolic and biological changes that we can influence with the choices we make about how to live. They're out there developing drugs to do this too, but there's lifestyle things, and that's what we're going to talk about next. All right, so it's good to see the sea. It's very soothing. And so just by way of summing all of that up, I'm not going to read this. I've read it so many times, but this is just okay. That's what we talked about so far. If you just came in the past few minutes, all we did was talk about what causes osteoarthritis, mechanical stress, dysbiosis, leaky gut, immune changes, inflammation, autonomic imbalance, oxidative stress, mitochondrial stress, and metabolic stress from blood sugar control issues and diabetes and metabolic syndrome. So that's like summary of what we've done so far. And if you want to get the details, there'll be a replay. Um, all right, so let's move along. Let's think about what to do about osteoarthritis, because that's really what matters. This is where the metal hits the road, or the rubber hits the road, the pedal hits the metal, I don't know. The goals are to reduce pain, improve function, and slow or stop the disease process. So we're going to do a big picture, and we're going to get a view of reducing pain and improving function or stopping the disease process. And my hope is to produce more content about the details so that you can understand it, so you can do the things that you can do for yourself, because it's so important to empower yourself with things that you can do to take care of yourself. I also, a lot of us do this work one-on-one with people, and I'll talk to you about that too. So there's the old school approach and the new school approach. Old school is 20th century medicine. New school is 21st century medicine. Let's go forward, Kadima. So what to do, the conventional approach. We've all heard about this probably. Things like analgesic medicines like Tylenol and NSAIDs, non-steroidal anti-inflammatory drugs, advice to lose weight, and then injections like steroids and hyaluronic acid, which is kind of like joint fluid. And then there's physical treatments, mainly exercise, but other modalities and acupuncture. These are things that are all getting lots of use in the past decades. And this is the way I train. This is what I learned to do for people with osteoarthritis. And what I've learned subsequently is there's serious issues with some of these things that they're not even putting out there in mainstream stuff because the view is like, this is the best we've got. So, and we'll touch on some of those issues in a few moments. So the problem with conventional approaches, first of all, there's no evidence that actually changes the disease process. And there is evidence that it might worsen the disease process. So let's just unpack that for a second. Um, all right. So, oops. I didn't want to show all that stuff in your face. Um, okay, so medications, there's toxicities, right? Everybody knows that Tylenol, if you take too much, can hurt your liver, and too much depends on the person. And if you have other issues that are stressing your liver or other toxification issues, less Tylenol can be toxic. And everyone's not the same. And the conventional assumption is that, well, you can take 2 to 3 grams of Tylenol a day. But I know people who have impaired liver function. I know people who have fatty liver disease, which is an inflammatory, chronic, low-grade inflammatory disease of the liver. They have less capacity to detoxify stuff. Some people have genetic or nutritional issues that prevent the liver from detoxifying. So sometimes Tylenol can be great, but in the right measure. NSAIDs, non-steroidal anti-inflammatories, ibuprofen, naproxen, naproxen, and then all the prescription things like diclofenac and meloxicam. And you've probably heard of these things if you're dealing with chronic pain. And there's the obvious things everybody knows about, that they can cause gastrointestinal bleeding, that they can cause problems with the kidneys, that they can worsen cardiovascular disease and high blood pressure, and even trigger heart attacks. But there's this other thing that not most people don't know, which is that they can worsen joint inflammation. And, you know, this data, there's a couple things quoted as a 2021 study, but there's things going back longer than that, showing that sometimes people who take NSAIDs get worse. One of the things that NSAIDs seem to do is actually drive leaky gut. They break down that gut barrier. So you don't even have to get to the point of having a gastrointestinal bleed. NSAIDs start to break down the gut barrier. And what happens when the gut barrier breaks down? What happens when there's leaky gut? What does it cause systemically? Inflammation, right? So it's this crazy thing. Non-steroidal anti-inflammatory drugs cause leaky gut, which worsens inflammation. And so there's a number of studies, and this is back from 1998, intestinal permeability and inflammation in patients on NSAIDs. They reviewed a bunch of studies. There's research since then for decades showing that NSAIDs contribute to leaky gut, but it's not showing up in the literature. I just recertified in my field. I had to do a bunch of CME and read all these papers and answer questions. And I read this 2020, that year 2020, like review, like one of the professional expert bodies was giving their recommendations, consensuses about how to manage osteoarthritis. They talked about NSAIDs, and they didn't even talk about leaky gut. They didn't talk about NSAIDs causing systemic inflammation. Um, the most kind of compelling stuff about worsening joint inflammation may have been after they stopped collecting resources for that study, for that meta-analysis. But basically, there's a few different research studies where they gave NSAIDs to people and then looked at their joints 2 years later and found worse inflammation and joint space narrowing. The people who had NSAIDs were worse than the people who didn't. So real issues there. Um, yeah. Yeah, okay. So we also have topical NSAIDs. And this is an important thing because there are creams and ointments and gels that are made out of NSAIDs. And we actually know that those are better tolerated. And so if you have bad osteoarthritis and you don't know what else to do, and you're worried about taking something like ibuprofen or naproxen, you can take topical NSAIDs. There's diclofenac. There's
a bunch of different ones that are topical that don't get absorbed as much and they don't seem to bother the gut. And that was shown in a couple of different meta-analyses. The jury's out about whether they contribute to heart disease, from what I can tell. Okay, and then injections and steroids, right? Short-term benefits. You give a person who's got a hot, irritated, swollen osteoarthritic joint, you give them cortisone, they feel better. If they don't have a hot, swollen joint, then they often don't feel better, and it can actually worsen the joint, and it could create more joint space narrowing. We're seeing more research showing that corticosteroid injections, cortisone injections, can worsen the process of osteoarthritis. So I tend to avoid them unless it's an emergency. Um, let's move forward. We have so much to talk about that's actually more interesting. All right, so then there's this functional progressive approach. We talked about old school 20th century osteoarthritis management, and then let's talk about what I'm calling new school, because I tend to think progressively. I tend to think, okay, if we've got some research and we're doing things that are probably safe because they're not as invasive, then I'm more willing to take that step and share with people the reality that, okay, we don't have as much, we might not have as much research as we do with NSAIDs, but we know that NSAIDs cause all these problems and you've got pain you need to walk. So here are some of the things that research is telling us. Heal the gut, supporting detox pathways, nutrients, right? Let's just touch on this. We know that low magnesium is associated with elevated inflammatory markers. Low magnesium is associated with worse osteoarthritis outcomes. Low vitamin D is associated with worse osteoarthritis outcomes. So the nutrient status in your body is actually really important. And these things are incredibly inexpensive and easy to take. You need a little support with them. You know, B12 and B6 and B1 are so involved in so many different chemical reactions, but especially pain transmission and neurotransmitter synthesis. And these are things that are really important to pain. There's this big category of chemicals that are called polyphenols. And polyphenols come from plants. They are colorful molecules, the things that give blueberries and raspberries and celery and spinach and other living green things, the things that nature, God, evolution, whatever you want to call it, made for us to use and eat and enjoy, are profoundly disease preventing and anti-disease. They're antioxidants and they reduce inflammation, reduce pain. We'll talk about that in more detail. There's something called LDN or low dose naltrexone, which I use a lot for people who have chronic pain. And exercise is really important. Movement's medicine. There's something called microcurrent, and I've been consulting with a company that created a microcurrent device, really tiny electrical currents that actually reduce inflammation in a profound way. They reduce cellular stress, they enhance mitochondrial energy production. So this stuff is up and coming. There's gonna be physics-based devices that are electromagnetic, that are gonna do amazing things to your body. If you're of the age where you ever saw Star Trek and like, Bones McCoy would come along and go, and do this little thing on people and they'd get better. Like we're heading in that direction. I think in the decades, in the 100 years to come, we're gonna look back and think, oh my gosh, we used chemistry? That was so dumb. Like physics is so much better. Gentle electromagnetic fields, light, these things actually have physiologic effects and changes. So keep an eye on all of that. We should know that in the eyes of conventional medicine, all this stuff is experimental because we've got either a little bit of research or no research. But again, it's a different rationale. I don't have a slide of this, but one of my mentors decades ago pointed the picture of a lever, right? Like with a fulcrum and a lever on it, right? And if you're pressing really close to the fulcrum and you're trying to lift a load, you have to press really hard. Like if you're on a seesaw and you get really close to the hinge, you have to be really heavy to lift the other person. And that's kind of what a lot of interventional invasive things are. They're not utilizing the complexity of the biological system. So they have to hit hard, and that's where you get side effects. And on the other hand, a lot of natural approaches and products are using the complexity and the intelligence of the organism. So it's less force, it's less intensity. You're working with the system and its inherent intelligence. And that's why maybe they're more safe. And we'll hear about that when it comes to polyphenols in a moment. So stay tuned. Hope y'all are doing okay. People are asking great practical questions. How much B vitamins? What form? Oh my gosh, it's wonderful. It's got to be a whole other talk, Sandy. Thank you. I appreciate you asking. It's a great question. All right, so treating the gut. Neutral. We already did this, the same slide. Okay, so what do I do in my practice? First of all, what I want to say is sometimes the conventional approach is faster and more appropriate. I don't like to use oral NSAIDs, but if I'm working with a young person who's got a really hot situation, sometimes a week or 10 days of NSAIDs is okay. You take precautions. You give them stuff that helps protect the gut. It's like using antibiotics. I like not to do that, but if I have to, okay. Then there's replace the biome and support the body's natural health. Um, so again, I tend towards topical instead of systemic because the topical ones have less side effects, especially towards this whole biology of gut-brain axis and all of that. Steroid injections, somebody came to me about a year ago and she had really bad arthritis in her knee and she was having a flare up and her daughter was getting married in 3 days and she wanted to have a good time. And like curcumin's not going to help your joint and neither is LDN in 3 days. So I gave her a steroid injection and her joint was better in 12 hours. And she had a great time at her daughter's wedding. I think that's a good use of the steroid injection and so did she. On a similar note, I used to work in rehab a lot. So somebody has a fall or an injury, whatever it is, and it's pretty common. That stressor flares up their arthritis. And they're in the hospital and they come to rehab and they're in a subacute rehab facility and their arthritis is flared up. And if they can't demonstrate progress in their ambulation, the insurance company is going to cut them off and send them to a nursing home. God forbid. So in that situation, like, that knee needs to be better now or tomorrow so that this person can actually get up and walk and strengthen themselves after the stroke and go home and not get stuck in a nursing home. So, it's contextual, it's situational. So I try to treat the patient and not be dogmatic about it. And I encourage you to think that way too. And, whatever, in your conversations with your doctors, some people do great with opioids for osteoarthritis. I'm not a big fan, but some people come to me and they say, if I take one tramadol in the morning, I'm up and going and I feel great and I've been doing it for 10 years. Can you prescribe it for me? Sure, why not? It's working. In the meantime, let's try some other things because maybe we can get your system healthier and you won't need it. And if they're open to that, great. But if not, not. I try to be a good gas station attendant. Somebody wants gas, I give them gas. If they want oil, I give them oil. I try to convince them and explain to them to use the right gas and right oil. Let's keep going. What else? All right, this whole process of disease that we want to change, right? We talked about this before for the late arrivals. Welcome. Gut, brain, immune, axis, joint, sickness of osteoarthritis, that same process is driving a lot of other chronic illnesses. And it's important to address that. A lot of people come to me because they want that deeper underlying approach. And just so you know, I do this by telemedicine. I work through Rose Wellness, which is why this whole thing is called Rose Wellness, right? It's a company in America that lets me practice in a number of different states where I'm licensed. And I also do it where I live in Israel. And so part of it can be like, okay, I've got osteoarthritis. What do we do about pain and helping me deal with it so I can function? Great. But then there's this underlying reality of the underlying biological imbalances that we've been talking about this whole time that are driving not only arthritis, but potentially driving other chronic illnesses that can have horrible effects over time. So I like to think about all of that. So I do a really comprehensive assessment. We spend like 60 to 90 minutes. It's a functional medicine approach. It's time intensive, right? I want to know how widespread are the joint issues. Somebody who's got one joint that's bothered and hot, that might benefit from a very different approach than someone who's got 6 or 7 joints that are hot, or back arthritis and 2 knees. And it really depends on the context and how bad things are. And what's needed in the short term to help them get going, to help them get physically active, because physical activity shifts so much of this other milieu of complex systems biology. And then what's the individual sort of biological picture based on their history, their symptom inventory, and their conventional labs? What's going on in the gut? Mind, body stress, is there trauma, a lot of anxiety, immune stuff going on, oxidative stress? These things leave clues. They show up in the history. They show up in systems, that whether it's, you know, psychological cognitive symptoms versus skin symptoms versus, gut stuff. Like I do a really broad look, and that triangulates back and lets me know a little bit about what's going on here. And so like my approach, what I'm aiming to do and what functional medicine is about, and this is why I work with Rose Wellness because they're really into this stuff. But basically, this is another way of mapping out all the things I talked about, all these different variables of digestion, the immune system, energy production, detoxification, cardiovascular, signaling molecules. But like disease is a stream rolling downstream. Things start upstream and they roll downstream over time. And what we want to do is try to start rolling the stream backwards. We want to do the things that counteract and turn off the processes that create the illness experience. Okay, so what do we do after we do that comprehensive assessment? First of all, we think about functional workup because there are tests that we can do to really characterize what's going on in the gut, right? There's a test that I do with the biome that tells me, is there a balance in the biome? Are there inflammatory, nasty bacteria that tend to cause inflammation? Are there yeast that tend to cause inflammation? It gives variables about like the actual immune system in the gut and some of the molecules that show up in the gut when there's an overactive or out of balance immune system. It looks at pancreatic enzymes, and most importantly, it looks at something called zonulin in the stool. And zonulin is one of the markers that goes up when someone has leaky gut. And some people come to me and their zonulin is pinned, it's red, it's like, whoa, big time leaky gut. Somebody came to me after 15 years of horrible pain, completely dysfunctional. She's only 22 years old, miserable, unable to do almost anything. And all of the normal markers were fine. And we did this gut test. She had had um, gluten testing by the blood, which we know isn't sensitive. There's lots of different molecules that gluten can cross-react with and cause inflammation systemically and cause leaky gut, besides the ones they test for, which were designed to look for celiac disease. And so in the testing we did in that stool, we saw this massive anti-gliadin antibody, which is one of the gluten antibodies, and massive inflammatory markers, and she's miserable. And we just stopped gluten for 3 weeks, and she was like, oh my gosh, like life-changing. And that's from a stool test. But they don't do it in conventional clinics, but they do it. Um, so not everybody wants to do that. Not everyone can afford to do that. So sometimes we just do empiric treatments, things to address pain, inflammation, oxidative stress, gut health, nutrients, all the things we've been talking about. These are things that we can do to address them. So how do we heal the gut? First of all, why is this? All right. Yeah, we want to heal the gut to get out all those diseases. And I use an approach that's called 5 R's. These are the 5 things. We want to remove the bad stuff, meaning foods to which a person might be sensitive, meaning toxic bacteria or fungi or viruses. We want to replace missing stuff like nutrients that might be depleted. We want to re-inoculate the biome and create a healthy biome. We want to repair the gut lining, and we want to rebalance the brain gut immune system. Those are the big picture things, and there's lots of details. And I'm going to give a big picture idea of what those details are. But that's the general process we try to do. And that's how we heal the gut. And that's how we turn off that fire coming from the intestines, driving systemic inflammation and a lot of these other issues. Okay, I hope you're all still with me. So healing the gut, dealing with all of these different biological imbalances that are part of that sick intestinal and brain gut immune system. Okay, so let's get into this. So here we are, and we want to heal the gut. We want to address the biome, and we want to address the inflammation in the gut. We all know about probiotics, and we might not all know about prebiotics and postbiotics. Because basically, what do all those healthy bacteria in the gut eat? They eat fiber. They eat digestible and non-digestible fiber. And that's why fiber supplements are so important. There's something like called glucan, which is a fiber-like, but it's produced by various kinds of mushrooms and fungus, profoundly anti-inflammatory. Healthy bacteria digest it, it builds the healthy bacteria, and then they produce postbiotics. Biotics. The most well-known, well-mapped things are things called short-chain fatty acids, and there's something called butyrate or butyric acid, which you can actually get as a supplement. It's really cheap. And not only does it reduce intestinal inflammation, but it helps rebuild the gut barrier. And so when I'm thinking about healing the gut, yeah, these things are biome oriented, but they're also prebiotic, postbiotic, like shifting overall biochemistry and shifting the products that the bacteria in the gut are producing, which are great for the gut, healing the gut, and healing the system as a whole. I just want to step back for a second because I want to just share a thing that I've heard a lot from a lot of people, and maybe this applies to you or somebody you know. But I've listed 5 things: removing the bad stuff, replacing missing stuff, re-inoculating, repairing the gut lining, rebalancing the brain gut immune system. I can't tell you how many people have come to me and said, I don't think the problem's in my gut because I stopped gluten and I still have the problem, or I stop dairy or whatever it is. Like that's a good move, right? Because many people are sensitive to gluten or dairy or refined sugar. And there's certain things that I recommend people do initially if they're sick to do an elimination diet for like 4 weeks where you stop all of that stuff and see how you feel. And if you feel better, you gradually add those things back in and you see what's triggering you. So it doesn't mean being deprived for your whole life, but what it does mean is doing um, due diligence and initial effort to discover things that might be poisoning your gastrointestinal tract, driving inflammation and breakdown. And if you stop those things, and you can't kind of stop them, like one of my patients came back after 5 weeks. Oh, I did the gluten-free diet. It didn't help. Oh, interesting. So you didn't have any gluten? Well, I had a little gluten. What do you mean? Well, I had a piece of toast in the morning, but I didn't have all the gluten I was eating all day long. I'm like, great, that's less gluten, but that's not gluten-free. If you're sitting at a campfire with your friends and you stop putting wood on the fire and the fire is burning down, but then someone puts a piece of wood on, the fire comes back up and then like it goes down and then they put another, you're keeping the fire going and you need to let the fire go out. And typically we recommend doing that for 4 or 5 weeks. So that's really important, but that's not enough. All that is exploring whether there are food substances that are triggering your gut. And that's huge, but that hasn't told you whether or not you got dysbiosis. And it hasn't done anything to address nutrients you might be missing because of leaky gut and a broken down gut lining. It hasn't helped you. You haven't re-inoculated the biome. You haven't taken the stuff to help repair the gut lining. There's a rich literature about people with celiac disease who get conventional care, which says stop the gluten, and they do that. But so many of them continue to be sick, and so many of them continue to have endoscopic findings of a non-healthy gut for years because they're not doing the rest of this stuff because this is 21st century medicine and they're in 20th century medicine. They're just stopping the gluten. More and more stuff is coming out about the role of this stuff. More and more, we're learning about pre and postbiotic fibers and substances. We're learning about nutrients that heal the leaky gut. L-glutamine is a nutrient for intestinal cells. It's an amino acid. It's cheap. It's in powders and it's in capsules. There's other things I give along with that frequently, like aloe or marshmallow root, and a few other things that help kind of the not just the lining of the cells, but the cells that produce the mucus layer. Butyrate is the other thing. Vitamin D is really important. Omega-3 fatty acids are part of that gut lining membrane and really important, and they're anti-inflammatory. And like the butyrate I spoke about, postbiotic fiber, which I didn't put in here, and it's really a mistake, is anti-inflammatory polyphenols. And I'm going to talk more about that in a minute. But examples of that are things like curcumin and berberine and quercetin. And depending on what's going on for the person, depending on their clinical picture, one or more of those things might be more appropriate than others. There's a lot of polyphenols. We want to think about immune function. This is the place where LDN can be really incredibly powerful. LDN, in case you haven't heard of it, is a orphan drug. The parent drug is a opioid blocker. That opioid blocker is used for people who have substance abuse issues to block the action of the drugs that they might take. When you use LDN in very low doses, like 20th or a 50th of what's used for addictions issues, what it happens is it shuts down the opioid receptors for a few hours, and the body says, hey, I need more endorphins and enkephalins. The body produces more of its naturally occurring pain blocking, inflammation blocking chemicals. So you're triggering the body to have a more robust response of endorphins and enkephalins. For many people, that does an incredible thing in terms of reducing digestive system symptoms, reducing pain, reducing inflammation. There's a lot of preliminary research. LDN is one of those drugs that's never going to get big research because it's generic. It doesn't cost anything. So there's no company that's going to spend $50 million to do a full set of trials and get FDA approval for LDN. It's not going to happen. Anyhow, works great for a lot of people. Mind body care, we talked about how danger signaling ubiquitously at the level of the cells, the level of the organism, perceived danger, stress, anxiety. You can do all this great biochemical stuff, but if you're walking around in a stress phenotype, in an anxiety phenotype, in a post-trauma phenotype, you're probably not going to heal because that's probably driving your disease in a huge way, whether it's osteoarthritis or fibromyalgia or fatigue or any other number of chronic illnesses. Okay, so we want all that stuff to go away. What else? Some practical details. We talked about the LDN a little bit. Again, this is a off-label use, a compounded drug that you get at compounding pharmacies, very good safety profile. It's got to be customized to the person so that dose is right for the person. A lot of docs out there just want to throw it at people and don't titrate it properly, and that's no good. Curcumin coming from the turmeric. It's the spice of turmeric, but you really probably can't get enough eating turmeric unless you're eating a huge amount of turmeric. But curcumin, 500 to 1,000 milligrams twice daily, is a powerful anti-inflammatory. And I think I got some slides talking about, yeah, I do. Basically, curcumin, boswellia, some of these other polyphenols. Boswellia is also frankincense. And boswellia is another herb. It's another plant-based substance that comes from a root. And basically, not only does it pain blocking, but it blocks a lot of those inflammatory pathways that we were talking about. They're looking at curcumin and like, do I have that? Okay, I'm going to look at, I think I'll show it to you later in a minute. There's other things. I'm not going to get into dosing on this. What I should do is give a whole talk on these things and get into details because there's particulars and details. You got to use the right curcumin and the right boswellia because there's a lot of junk out there. I don't have a slide on this, but like there have been studies for decades showing that unregulated nutritional supplements very often don't have what's in the bottle, don't have what's on the label. The actual capsules don't have what's on the label. There's also evidence showing that they frequently are produced in ways that aren't safe. So you really need to get things that have good manufacturing processes where a third party has reviewed it. And you want some evidence that the actual what's on the label is what's in the capsule. So I want to talk about all that in more detail in another talk because we can't cover it all here. But these are some of the things that I use depending on the person. A lot of people have heard about glucosamine. Glucosamine got some interesting press a bunch of years ago because of the GATE study, which is this huge randomized controlled trial. Lots of people, it was the biggest, supposedly best study of glucosamine, but they used a different kind of glucosamine than what had been used in all of the previous studies. They used glucosamine hydrochloride, which is not glucosamine sulfate. And it was just an assumption that like, well, it doesn't matter if it's sulfate or hydrochloride. That paper that I mentioned, that review paper that I had to study and do answer all these questions to recertify recently, it actually commented in there, we didn't review glucosamine because the GATE study gave such negative results and based on a meta-analysis, we didn't see. You take a huge study and you put it together with a lot of smaller studies and the huge study is done wrong, it's going to make all those smaller studies look like there's nothing really happening there. And that's what happened with initial meta-analyses after the GATE study. More recent meta-analyses have shown actually, no, there does seem to be some benefit. And There's potential reasons why it. That paper that I mentioned, which is this expert panel that reviewed it, they actually said, we can't think of a reason why glucosamine hydrochloride wouldn't work as well as glucosamine sulfate. So we're assuming that the issue is with glucosamine and not the kind of glucosamine. You hear that kind of twisted logic? It was very disappointing. I was very disappointed in my colleagues. In any event, omega-3 fatty acids, fish oil is the most common source. Some people get it in green lip mussels. Some people get it in vegetarian sources that are grown from algae. You're like, where do the fish get the omega-3s? It grows in algae. It gets eaten by little organisms. The fish eat the organisms. That's why fish have omega-3 fatty acids. You need 1 to 2 grams a day. If you look at most fish oils, they'll have like total omega-3s, and they'll have EPA and DHA marked separately. What you want is 1 to 2 grams of EPA, DHA, not just the overall omega-3s, because the body has to produce the ones that are really anti-inflammatory. And these are the ones that have the most data supporting their anti-inflammatory effects. I was also listening to some other research lately about how EPA and DHA helps the person maintain muscle mass as they get older. And that's a really huge thing because muscle is metabolically active. There is a practice in New York that's muscle-centric medicine. There's a lot more research coming out about how physical exercise, using your muscles, reduces inflammation, shifts all this sort of oxidative stress stuff. It's a really huge thing. So maintaining muscle mass is incredibly important. And omega-3 is showing up as something that seems to help maintain muscle mass too. Let's move further. Treating pain and inflammation and oxidative stress. I mentioned magnesium, vitamin D, B complex, very important things. And here's a meta-analysis and a systematic review of curcumin. And they looked at 1,620 and 21 people and did better with pain control, did as well as NSAIDs without as much side effects. The key thing is you need to use curcumin for 3 months. But it seems like it works as well as NSAIDs if you get a good quality curcumin, if you take enough and you take it for 3 months. So it's a reasonable substitute. If a person's got osteoarthritis, they're dependent on whatever NSAID, it's a reasonable thing to switch. And I do this a lot with people. Polyphenols, like we talked about, eating the rainbow, all the colorful foods and in nature. This is a review article. It's entitled Dietary Interventions with Polyphenols and Osteoarthritis, a systematic review directed from the practical data in clinical studies and nutrients. And I got to get closer to this to see it, and maybe you do too, so forgive me for my face getting out of it. But basically, what they find with polyphenols, lots of different colored foods, is first of all, anti-inflammatory effects like we talked about. Um, Anti-pain effects, blocking pain, reducing oxidative stress, and working on various signaling pathways, and anti-aging catabolic pathways. Kind of hard to explain that, but the point is nature's bounty, the colorful foods that are so important to consume in quantity and build into your diet. We've got all this research out there looking at plant-based diets and how much better they are than meat-based diets. And everyone's assumption is meat is bad for you. And it can be. I'm not knocking that research as a whole. But when you look at something like that, you have to realize, well, like eating more plant-based foods does all sorts of amazing stuff to reduce the things that are driving chronic illness. Because like I spoke about in the earlier part of this talk, there's a whole set of biological processes, inflammation, oxidative stress, signaling, um, DNA changes and mutation that are drivers of osteoarthritis and drivers of chronic illness. And polyphenols, colored plant and fruit-based substances, are turning those processes down and moving them towards a healthy direction. So polyphenols are powerhouses of nutrient for so many reasons. So this is a huge amount of information, but this is another systematic review and meta-analysis of curcumin. And basically, this is just supporting the idea about all the pharmacologic things that curcumin does, blocking all of these molecules that are involved in driving inflammation inside of the cell, inhibiting oxidation by removing free radicals, promoting cartilage repair by affecting a whole bunch of different proteins that are living inside of your joint. So it's not just about inhibiting pain, it's about actually changing the process of disease. And like we talked at the beginning, there's 20th century medicine, which is all about palliation and let's block your pain and hope you don't need a joint replacement. And now we've got these substances that we're starting to measure in such an unbelievable way that are nature-based. They're they're available, they're being produced, they're being refined about how to deliver them, how to absorb them better. And not only do they block pain, but they block the process that drives the disease process. So that's really cool, and I'm really excited about that. And I don't even own stock in curcumin. I just think it's great. Okay, so blocking pain, we kind of talked about that. Yeah, I'm going to run through a few things. We've been at this for a little more than an hour, and I think somebody else needs to use the Zoom soon. So I'm going to just kind of move through. Can you spell butyric acid? Butyric. Buty. Butyric. RIC. Um, Pain's not like a light switch. You got an incredibly complex pain transmission pathway. It's full of these processing steps in your spinal cord, in your brain, before it gets to the part of your brain that says ow. And there's amplifiers in your spine and your brain, and those amplifiers can get turned up. And we call that process central sensitization. And we know that it happens in osteoarthritis. We know that it happens in fibromyalgia, in neuropathy, and a whole bunch of different things. We suspect that part of it has to do with like those attack macrophages we spoke about, but it can come from stress, it can come from inflammation, it can come from nutrient deficiencies. This is why it's really important if you have chronic pain to look at all those things carefully. That's a big part of what I do when I consult with people is like, let's cover the bases. What are all the things that can cause central sensitization? Let's see the things that we can change, check off, and shift. Let's unpeel off the layers of things that can drive this central sensitization process. We talked about autonomic nervous system. Let's just reviewing that. That's a big driver of central sensitization. So many people I know who have come to me miserable with chronic pain, and they dealt with their trauma and their pain got a lot better. It's not to say that everybody who has pain is just from trauma, but a lot of it is. And many of you may have heard of John Sarno work, Dr. Sarno. It's an approach, it's a systematic approach that a lot of docs do and a lot of lay people teach other people to really get at the emotional layers, writing exercises, identifying sharp, hard emotions, because that turns off that autonomic nervous system imbalance. And it also corrects a lot of brain chemistry and neuropeptides and signal molecules that may be holding an emotional response that's contributing to a pain response. So moving forward, pain reactivity and disability, this is a huge thing for any chronic pain problem. Here's the cycle, right? The pain experience for some people creates what we call the pain avoidance cycle. Pain catastrophizing. Oh my gosh, I've got pain. I can't do anything. This is never going to get better. It's a disaster. I'm going to be a wreck. Forget about it. All those thought patterns that get triggered that are part of that stress response, part of chronic anxiety. And this is not to shame or blame anybody, but to recognize that that's a big driver of the cycle. And catastrophizing is one of the things that turns up the volume on pain transmission. This has been demonstrated in functional MRI scans. Really important thing. Okay, so pain-related fear, avoidance, and hypervigilance. A lot of people who have pain are guarding their joint. They don't want to move. I see this in my practice every week of people who've had the injury, they've had the surgery, they're having pain that persists. No one knows why. The orthopedic surgeon says everything's fine. Part of what's going on is they're like holding their body. And it's not on purpose. It's a reflexive thing. You add some anxiety into it, it makes it worse. You add some biochemical imbalances, B12 deficiency, other different things that can make the neurologic system more irritable, magnesium deficiency, you get more of that. And that creates a secondary source of pain. So it's really important to think about these things, including in osteoarthritis. And that process of not using the limb, not using the body part, leading to disuse, depression, disability, which feeds that whole catastrophizing pain experience. And the way out is to break through the fear. And you got to find whatever way you can find, whether it means getting psychological support, uh, doing some Sarna work online, finding your best friend to scream at you if that works for you, getting up and moving, figuring out if it's pain that's dangerous or not. Most chronic pain is not dangerous, but the body doesn't know that. The fear response of the body doesn't know that. And when your fear response, your body thinks that your pain is dangerous, it feeds that vicious cycle of biology and neurochemistry and inflammation and all of that, and feeds into the sickness of chronic pain. So breaking out of that, confronting it, moving forward, recovering. Huge, huge thing. Sometimes you need support. Sometimes you need a great physical therapist or emotional therapist. This is just mapping it out again. We already kind of talked about it. So I'm not going to talk this through because we don't have so much time, but like that's how it works. I see this hundreds and hundreds of times where all these biochemical imbalances and metabolic imbalances we talked about sensitize the nervous system, create this whole distressing suffering experience, drives autonomic imbalance, feeds it all, and then feeds into fear avoidance. This is chronic pain syndrome. And getting it addressed is hugely important. And this is what I've been doing for over 20 years. You need to see someone who really knows pain who can help you out of it if you've fallen into this cycle. Stuff you do for yourself, strength and coordination. I love gentle, mindful movement for chronic pain because it's gentle, because you're relaxing, you're stimulating the relaxation response while you're strengthening the body. So Tai Chi, Qigong, Yoga, Pilates, whatever it is, there's a lot of different approaches. Feldenkrais could be on here. There's all sorts of great techniques for retraining the body to move freely if you have chronic pain. Osteoarthritis, if you go, I went to China many years ago and I was in medical school. You go to any park early in the morning, you got all these elderly people moving and doing Tai Chi. It's like the national pastime. And part of it has to do with the effect on the joints and moving the joints through the full range of motion. Are we got a bunch of people here who are in my movement towards health Tai Chi Qigong based class. You guys want to speak up and tell me? No, I'm just kidding. But it's really good stuff. Aerobic exercise is good if you can do it. Strength training is really good if you can do it. The muscles of the joint need to be strong. That's the piece we haven't really talked about, but one of the things is that in osteoarthritis, the loss of joint position sense and coordination happens before the joint breaks down. Crazy, right? That's one of the things doctors aren't often thinking about. So the basic idea is that the deconditioning and the loss of the neuromuscular intelligence of the joint is part of what contributes to the degenerative process. So it's really important to think about that. Movement is medicine. It generates hormones, reduces inflammation, signaling molecules, helps you sleep, reduces pain, neurotransmitters. Have I said this enough? So important to find a way. I'm going to do another talk about osteoarthritis and movement training. I'm going to do another talk, please God, about osteoarthritis and polyphenols. And we'll get into some more of the details here. I know this is a superficial overview, but I wanted to get you the big picture. What else? Mind body healing, so many different layers to that. Relaxation response, mindfulness. We don't have time to really talk about this, but it's a whole area of self-healing through the mind-body system and the intelligence of your own consciousness. I'm not going to go down this road and talk about these things in detail. I want to leave a little time for Q&A. These are some of the processes that people go through as they're healing inside, healing the deeper layers of your being. I know a lot of people who've had trauma or difficult experiences, and they get CBT, which is mainly about functioning, cognitive behavioral therapy, but they're never working on that heart-centered or body-centered nervous system. The stress response is in the body, and you can get your thoughts in shape, and that can help you a lot. But until you meet the hypervigilant emotional responses and the hypervigilant biological responses and transform them and rewire them, then they're going to continue and they'll continue to drive disease. And there are safe, proven things to do that. And it's worth a whole talk. It's really worth it. Okay, great. So I think that's the end, folks. Thanks for staying so long. I had no idea how long this is going to